Everybody. It is time to get started for our monthly HICP meeting held this first Friday of every month. It is December already. I know that is incredibly hard to believe for all of us, but we are very excited to spend this couple hours with you this morning. It'll be an exciting and really rich conversation, I think, with discussions and presentations on housing initiatives in our community, as well as transportation updates. But we'll get started in just a second here. With that, let me move forward in the slide deck. So first things first, of course, we will be hosting our meeting via Zoom. So we want to just make some tech tip reminders for all of you. Please do mute yourself unless you are speaking. We do allow everyone to participate fluently in the conversation. So we're excited to allow people to mute and unmute themselves directly, but we do prefer that you be muted unless you're speaking. You can also use the controls at the bottom of your panel. You can mute yourself by clicking on and off of the microphone and turn on and off by clicking the camera icon. We also have simultaneous translation available via the translation globe at the bottom of the screen. If you want to see who else is in the meeting with us, please look at the participant list. You can also use this feature to raise your hand and ask to be at an appropriate time for questions. We also greatly encourage people to use the chat feature, as it's a wonderful way to continue a conversation. Make sure you don't forget the notes that you want to ask the presentation. We like these meetings to be as interactive as possible, and with a full agenda, not always possible. However, we do encourage everyone to please, please put your questions in the chat. Please raise your hand so we can call upon you at the appropriate time, and we will ask for questions and open our space for Q&A at the appropriate moments during the presentation. Before we get started, I'll go ahead and read off the guiding principles for the Health Innovation Community Partnership. These were developed and incorporated as part of our vision and mission document and really guide the way that we seek to work together to achieve positive solutions for our community. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious, and seek to understand various points of view. Participants will explain their reasoning and intent, share how we reach our conclusions so that others can understand our reasoning. Participants will attack the problem and not the person or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share relevant information. Participants will always arrive for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information from which to solve problems and make decisions. Participants will jointly decide next steps. With that, let's go ahead and dig in a little bit on our agenda today. As we just did, we went through our welcome, our meeting overview, and guiding principles. We're going to pivot in just a minute to an update on the LAC USC Medical Center campus from our own Jorge Orozco, CEO of the campus. We will then have two presentations on LA County initiatives to address homelessness, one on Project Home Key and one on the Viña Street project. We'll then have some time for reflection about the issue of homelessness in our community, what we're observing, what we're seeing during these times of COVID. That will be led by Monica Alcaraz of Exodus. Then we'll move on to some county updates about various projects impacting the campus and local area and relating to our work at the Health Innovation Community Partnership table. Finally, we'll conclude with two presentations on transportation initiatives that are deeply underway and will have a lot of positive benefits and potential impacts to our community. So we're very excited to welcome our guests from Metrolink and from the other transportation projects. With that, I think we go forward with our quick little update, a quick little announcement that I wanted to make. We, as mentioned at the last HICP meeting, we are working with the University of California at Davis and the Boyle Heights Building Healthy Communities to host a series of conversations about police in our community. We have held two sessions so far, and we have a third one scheduled for December 2nd that is intended for institutional leaders. We're hoping that people that work in organizations in the Boyle Heights area, that work on the medical center campus, that want to engage in a 2-hour dialogue on what police reform might look like. What would our hopes and ambitions be if we rethought policing in our community and on our campus? So we're inviting you to please join us in that conversation. It'll be a small group of 10 to 12. And if you are interested, please put your name in the chat or contact with my colleague, Dalila. We're still seeking a few more individuals to join us at this event. It should be very interesting, and it's part of a statewide initiative where UC Davis is hosting community listening sessions up and down the state to really hear from residents and leaders in local communities about what our recommendations and ideas might be for reforming policing in our communities. So please join us for that. And if you're interested, I encourage you to put your information in the chat so Dalila can be in touch with you. All right. With that, I'm going to invite Jorge Orozco to share with us some of the updates from what's happening on our campus during this time of the COVID surge. Jorge. There you are. You are muted, Jorge, or somehow I can't hear you. Is it working? I see you. I do not hear you. Uh-oh. I don't know, if at the bottom of your screen in the controls, the audio settings, if you go to the microphone button in the down arrow, there's something called the audio settings. No luck. Yeah, you want to call in for us? That'd be great. I feel like we're getting a little background chatter of some little people. So if you are not speaking, if you could please mute yourself. It's wonderful to hear children, but maybe we could exclude their sound from this meeting. All right. Well, as we wait for Jorge to join us, I'll also make another quick announcement. The Wellness Center, alongside many other community-based partners, are working with the LA County Department of Public Health on a massive community health worker outreach initiative. We are really delighted to be part of this incredible plan to bring messaging and materials around the COVID pandemic to hard-to-reach communities and vulnerable communities that are most impacted. This is a countywide that involves 17 different agencies, everywhere from Antelope Valley all the way down to Long Beach. So the Wellness Center is one of the agencies involved, and we just wanted to kind of let you know that this is happening, invite your collaboration with us. If you have upcoming community events or opportunities for us to do outreach in partnership with you, we're particularly looking for virtual strategies that will help us get the messaging out without endangering anyone or encouraging the potential for communication of the COVID virus. So we're thinking we will be doing a lot of social media, a lot of phone-based outreach, and we're also making family-based PPE kits that we'll be distributing at community events and community centers and sites around the area. So very excited to have you join us there. Are you with us, Jorge?
I am.
Yes. Yay.
Is there an echo?
Welcome. There is, but I think that's me. Let me put myself on.
How about now? Kind of. I think I don't know how to mute my screen, but let me see.
Possibly if you could mute the speaker on your computer.
I know. I'm trying. Someone can. Let's see. Sorry about that. I've got two screens. One screen is muted. The other one is not.
Oh.
You can also disconnect from computer audio on the Zoom app. If you go to the audio settings, go to disconnect computer audio.
Okay, let's see.
So if you go to the little microphone and then there's a little down arrow next to the microphone, click on that and then go to audio settings, and it should ask you to switch to your different microphone and your different speakers.
Okay, how's that?
Perfect.
Okay, sorry. Well, good morning, everyone. Just an update on what's going on at the Med Center. We, frankly, are worried. We have our inpatient census for COVID has doubled in the last week and a half. We currently are at about 88 inpatients in the hospital, but our hospital is 92% capacity. Means we're full, and if we continue this trend, we're going to be over full. We are doing everything possible to make sure that our beds remain open, but it is challenging. There are many employees who are off because of quarantine, and really our limitation is expert staff to care for patients. So we are redeploying staff from other areas of the hospital to the areas that are hit hardest, like our ICUs and our PCUs. We have increased registry rates for nursing to a really high rate to try to attract nurses to come and work here on a temporary basis. The problem is the rest of the country is doing the same, and so because this is a challenge at all hospitals, it's difficult to bring in additional resources. So, you know, we are hopeful that we'll get to the race of a vaccine. Just to let you know, we are expecting our first shipment of vaccines here in 2 weeks. Healthcare workers are first in line to get the vaccine, and so we'll set up a system to be able to distribute those vaccines. We're going to be a regional distributor of vaccines here for other healthcare organizations, but we will be vaccinating our workforce in a couple of weeks. We're doing fine with personal protective equipment, but I do want to acknowledge the tremendous stress that our employees are going through at this time, and really recognize their dedication on a daily basis to keep our community safe. So I'm happy to answer any questions that you all might have.
Jorge, this is Monica. Can you talk about the safety of the vaccine? Because that's like something that I think a lot of people are worried about, like, you know, and there's a lot of theories about that, you know, having the community of color, you know, be like an area where they want to target that vaccine, and, you know, people saying, oh, I don't want to be a guinea pig. I don't want to be the first one. So can you talk about that?
Yeah, there is a lot of misinformation around vaccines, especially during this pandemic. I mean, really, there are concerns given that the vaccine was developed so quickly, but the process and the rigorous oversight of the process by the FDA is something that, you know, isn't being compromised. And I really rely on experts who know vaccine development, who know immunology, and, you know, I have asked them, hey, you know, are you going to take the vaccine? Is your family going to take the vaccine? And by and large, all of them have said absolutely. If we see the data, which the specific data hasn't been shared, but once the FDA gives an approval, it will be shared broadly in the public. If we see the data of the phase 3 trial, and phase 3 trials is where I believe over 30,000 individuals were given the vaccine and were monitored for signs and symptoms, for safety. And if that all looks good, absolutely, we're going to take the vaccine. Really, this is our best path towards changing or overcoming this pandemic, and we really need to encourage people to take the vaccine. Other thoughts, questions?
Yeah, this is Ari. I have a question.
Hi,
What
Ari.
about, you mentioned, good morning. Boy, there's a lot of noise in the background. Okay, so you mentioned that the hospital is at capacity. What I recall that back in March, I think you had a plan for expanding, on the grounds, like some sort of tenting or something. I think other cities, for example, I think New York, they ran into a problem because they had tents out and then came a big storm. So weather problems. Nonetheless, do you have a plan for that? Is that, expanding the capacity? I understand that what you're saying is you can expand the capacity, but what about the people working there? Anyway, what is going to happen? What are we going to do?
So we have set up 3 triage tents outside of our emergency department, and those tents have been set up since February, and we haven't really used them. This week we used them probably for the longest period that we have throughout this pandemic. The tents give us a way of triaging patients so that we could catch up. You're absolutely right that the main limitation is staff. And so we have enough space on our campus in different areas to expand, but we don't really have the expert staff to care for patients with COVID, with respiratory issues. Now, what happened in New York and in Italy, all sort of standardized medical protocols went out the window. And it was really battlefield medicine, which is anyone who is present, do your best, take care of the patient. We are not there yet, and we have not been there, and we hope to never get there. One of the things that we're doing is we are aggressively moving patients through our different levels of care. That is, if someone is admitted to the ICU, as soon as we can get them out of the ICU to a lower level of care, we move them. If they're on our unit, as soon as we can get them home with home support, we're moving them. So we have been treading water for the last couple of weeks, and we are really hopeful that even though the volume of patients that we're seeing with COVID is much higher than it's been at the peak back in July, these are patients that are less sick and less severe than we've seen. Having said that, we have a much higher volume of them coming in. So that's what's impacting our census. So we are hoping that we can continue to tread water.
I'll take another one. Are you, am I understanding correctly that there are more therapies, and so therefore people are, number one, surviving, more likely to survive, and also maybe not need to go into the ventilators and that sort of thing. So therefore, that's part of what's creating the high number of people in the hospital. They're not dying off as quick.
Yeah, we've learned a lot through this pandemic, and so what we're doing today is very different than what we did back in March when this started. So there are therapies. I think initially we were very quick to put people on ventilators. Now we're trying to avoid ventilation as much as possible and using high flow nasal oxygen programs that are sort of an alternative. But I don't think they're staying in the hospital longer than they were before. And actually, we were able to move them more. I think the volumes are what's driving the increase in our census. We're getting many more people coming to our emergency room, and even though those that we test in the emergency room before admission, the percentage of positives is lower than it was back in the beginning, the volume is greater.
We have a hand raised from Juana Mena.
Hola, Juana.
Hola, buenos días. Jorge, gracias por todo su trabajo que está haciendo, pero escuchándolo a usted preocupado, a mí como residente, lo que me preocupa es toda la información que llega a las noticias y es muy diferente a lo que estoy escuchando de usted, a lo que escucho de las noticias, y todo eso es lo que está creando un caos en la comunidad. Y el estrés hace que la salud mental de las personas en la comunidad se descompense. Entonces, ¿cómo es que los medios tienen esa información? Si ahorita escuchándolo a usted, yo escucho mucha diferencia a lo que escuché ayer en las noticias.
Gracias, Juana. Pues las noticias están hablando con nosotros y hemos salido en Univisión y estamos dando el mismo mensaje. No sé cuál mensaje está oyendo, pero el mensaje de que están subiendo los casos en el condado de Los Ángeles es lo que está pasando, y que los hospitales se están llenando en el sur de California. Es la verdad, y el gobernador ayer puso otra orden. Si llegan los cuidados intensivos al 85%, entonces va a tomar más pasos para limitar lo que está pasando, las libertades que tenemos en la comunidad. Entonces, no sé exactamente de qué refiere de las noticias, pero sí es lo que está pasando ahorita.
Sí, es referente a los hospitales, usted lo acaba de mencionar. Yo, pues, como paciente y mi segunda familia, mi segundo hogar, el hospital, yo estoy muy agradecida porque yo he visto el esfuerzo que hacen cuando uno llega a la sala de emergencia por la atención que le tienen. Pero ahorita yo veo que está el tiempo, la temporada fría, y veo tanta gente en la calle, uno sin cobija, sin nada. Entonces veo yo que se van a enfermar más, y toda esa gente, ¿a dónde va a llegar? ¿O
Sí.
van a aumentar el caso de personas que fallecen en la calle? A lo mejor me estoy yendo a los extremos, pero de verdad sí me preocupa. Yo agradezco su tiempo para contestarme.
Sí. Pues, mire, el mensaje de nuestro hospital: aquí vamos a estar, aquí nosotros no nos vamos a ir a ningún lugar, y vamos a hacer cualquier esfuerzo para dar el tratamiento necesario para mantener la salud de nuestra comunidad. Entonces, estamos todos los días evaluando lo que está pasando, hablando con el resto del condado para mantener nuestros servicios al nivel que es apropiado, ¿verdad? Y vamos a seguir haciendo eso. Y ojalá que la comunidad no se junte mucho, use sus máscaras, lave sus manos, porque esos son las cosas básicas que va a prevenir los casos que sigan subiendo.
I just want to make a quick announcement that for those that would like simultaneous translation into English, you can access that via the globe at the bottom of the screen. We also have some summary notes provided by Dalila in the chat that summarize some of what was just exchanged between Juana and Jorge. Are there any final questions for Jorge? Any concluding comments on your end, Jorge?
No, thank you all. And I think really the message is to our community is, you know, we do need to follow the basics, and this is very real. The holidays, we're in the holidays. You know, a lot of what we're anticipating in the next couple of weeks is the impact of Thanksgiving. And as we move into the Christmas season, you know, people need to please listen to the recommendations to keep gatherings very small within households so that we prevent this spread.
Thank you so much again, Jorge, for your work, for the incredible efforts of our campus, and for being, you know, a safe and trusted space for people to receive excellent care. Thank you.
Thank you so much.
All right, with that, we will move forward in our conversation today. We have many presentations ahead, so thank you for continuing to join us. Once again, we do have simultaneous translation between English and Spanish, so please pick the language of your choice in the globe below, and then you'll be able to be connected in to hear all of the content in the language of your choice. We already talked very briefly about slowing the spread, and I really do appreciate all of the efforts of this collective body to ensure that good quality information is shared with our community and that we are protecting those most vulnerable to the COVID-19 pandemic. With that, we're excited to welcome members of our own LA County CEO's office to share with us some wonderful and exciting things that are happening around the in the local area related to Project Home Key and the Vinya Street project. So with that, I'd like to invite Kelly, Quinn, Elizabeth, and Matthew to take it away with your presentations. We're going to need to unmute you, Kelly. I still see your line muted somehow. There we go. Try now.
Can you hear me now? Great. Well, first of all, it's really nice to see everybody, even if I just see a tile with your name on it. We haven't been able to participate. Hi, Anna. We haven't been able to participate for some time, and it's nice to come home and talk about Home Key with you. I want to also let you know that Ivan Matthews is on the line. He's not on the screen due to some internet, those persnickety internet issues. But Ivan's on, and with Ivan's leadership and the fantastic work of our team, including Liz Benishai, who will help make this presentation this morning, we have accomplished a lot. It was a mammoth effort, and I'm thinking about what Jorge said about battlefield medicine. We had a kind of our own version of a battlefield mentality with all hands on deck and kind of doing the best we could with, you know, all of us learning, steep learning curve through the whole process. So Heather, if you could advance the slide to the next slide. Thank you. So what is the Home Key program? The state of California enacted an allocation of the Federal CARES Act funding for this program to acquire hotels and motels and other properties to provide housing for persons experiencing homelessness and thus at great risk for contracting COVID-19. It is a statewide program. It was a competitive program, and the state sure took that competition seriously. There was quite an elaborate application process, which Liz Benishai very ably led, and it was very rigorous and demanding. The acquisitions for HomeKey per the coronavirus relief requirements from the federal government is that the funding must be expended by December 30th. So we had a very short window. My boss likes to say that it usually takes the county a year to buy one property, and we were actually able to buy, we have one more to close on, but buy 10 properties in about 4 months. As you can see here, the governor allocated $800 million for the acquisition and about almost another 95 or so million for operating subsidies, which are very essential to the program. We landed $108 million, which is pretty impressive, and we were able to buy almost 850 rooms. As I said, we had a very short turnaround. The applications were announced in late July, and they were due in mid-August. If you go to the next slide. Thanks, Heather. Here's how they lay out properties in Baldwin Park in the unincorporated areas of Hacienda Heights, Harbor City, and Whittier. 2 sites in Long Beach, 2 sites in Compton, and then a site in Norwalk and Commerce. And you might say, well, how did you come up with those sites? Well, it was a mystery to us for a while, too. We vetted about 38 properties that came in through room key sites that were interested in selling to the county, random interested property owners, board offices, and DPW very ably with Andy Moe's leadership. And I know Andy's on the call. Thank you, Andy, for everything your fabulous team did on this effort. They, in a very short order, vetted to some level each of those 38 properties. And as we continue to winnow down the list, looking at building condition, looking at the risk of any loss due to a major seismic event, environmental conditions, and property title. We learned a lot in this process about how a very complicated, unclean title can actually make it hard to sell your property. And then last but not least, we undertook appraisals, and appraisals ended up being a big driver in why we actually have no room key sites in the northern part of the county. We could not come to terms with property owners, and the county needs to essentially abide by the appraisal of full market value in order to close the deal. So I want to, if you go to the next slide, I want to just highlight that, as I said, it was a competitive grant program, and there are other home key sites other than the 10 red stars you see on the map. This map, which is a point in time snapshot that we probably prepared, I don't know, 6 weeks ago, shows 13 other sites with another 682 rooms. So at that time, there were about 1,500 rooms procured between the county, the City of Los Angeles, the Housing Authority for the City of Los Angeles, the City of Burbank, and the Long Beach. We know that there are some other sites out there that are not on the map. We don't have information on those yet. The City of Los Angeles has another 4 sites. We know that the City of El Monte has a site, and there could be a few others. But that's essentially a snapshot of where we are. As I said, we have one more property that closes the process of acquisition on Tuesday, December 8th, and we will have met our deadline and created over again, in collaboration with the other jurisdictions, over 1,500 rooms. Think of this effort, and Liz will talk about this a little bit, think of this effort as essentially buying apartment buildings, and there'll need to be a conversion process. And with that, I will turn it over to my wonderful teammate and colleague, Liz Benishai.
Thanks so much, Kelly. I'm really happy to be with you all today. I'm going to talk a little bit about what we'll be using these sites for and how we're operationalizing them. As Kelly mentioned, there are 10 sites that we have acquired or will finish acquiring next week. 9 of those sites will initially be used as interim housing or temporary housing, and then they will be converted to permanent supportive housing by the end of calendar year 2022. And that conversion process primarily involves adding kitchenettes to the rooms. All 10 of the properties that we purchased were hotels. They're now former hotels. And so of the 10, 9 of them didn't have kitchen facilities, which are required to make them suitable for permanent housing. One of the sites did have kitchenettes, and so for that site, which is the one that we'll be closing on next week, we will immediately begin using it as permanent supportive housing. I think everyone on this call is familiar with that kind of modality of housing, but for those who aren't, that's a permanent housing subsidy combined with supportive services. And it's an effective intervention for folks who are chronically homeless or have a disability. We are working closely with our partners at the Department of Health Services Housing for Health team and at LAHSA, who are overseeing the operations of home key sites. They are in the process of contracting with homeless service providers who will operate the sites and provide supportive services on site. If you could just go to the next slide, please. So particularly at the sites that are going to be administered by DHS's Housing for Health program, there will be varying levels of clinical services provided on site, depending on the capacities and specializations of the particular providers who have been selected to operate those sites. So clients will be referred to sites that are best able to meet their specific needs. And whether that is providers who have expertise in substance use disorders or particular behavioral health conditions, there's a sort of variety of services that are going to be offered. For placement, clients will be prioritized according to a few different categories. We're eager to ensure that clients who are currently in Project Room Key sites, and again, I think folks are familiar with that program, but that was the statewide effort to enter into agreements with hotels to provide temporary housing to COVID vulnerable people experiencing homelessness, and the county had 38 sites. Some of those are demobilizing, so clients who are currently in those sites will be prioritized to be transferred into home key sites to uphold our commitment to make sure that room key clients are not returned to the streets. As well, we know there are many other COVID vulnerable people experiencing homelessness who are not in room key, who remain on the streets or in congregate shelter settings that are not the safest places for them to be under the current conditions. So those folks will also be prioritized. And then clients who meet the criteria for permanent supportive housing, who could potentially transition in place once we convert the interim housing sites into permanent supportive housing. So they would not have to exit the program physically, they would just remain on site and then be able to live in a permanent supportive housing unit. And then it's not on the slide here, but our partners at Housing for Health are of course very aware of the heavy burden on our healthcare system right now. So clients who are experiencing homelessness, who are currently hospitalized, are also being prioritized for entry into the home key program so that we can quickly free up beds for clients who no longer need to be hospitalized, whether for COVID or for any other purpose where they would be utilizing hospital space. We can get the next slide, please. Just to give you a sense of the timeline for the conversion process and operations, as Kelly mentioned, this whole effort has been under a very tight timeline, and one of the commitments that we made to the state as a part of being awarded these grants is that we would very quickly occupy the sites and have them operationalized. So as we speak, the providers are preparing to move clients into the home key sites. 5 of the sites will have occupancy by the end of December of this year, by the end of this month. 2 sites that we acquired are current project room key sites. So those sites were already occupied and the clients were able to stay on site and have a kind of seamless transition. And then another 3 sites will be occupied by the end of this month. And then the remaining 5 sites will be occupied by February 8th to comply with the 90-day occupancy requirement that the state had asked us to fulfill. The process of converting to permanent supportive housing will begin immediately in terms of planning and design and permitting. The actual construction process for the permanent supportive housing conversions we expect to begin in January 2022. And we expect that to conclude by the end of the calendar year 2022, at which point all 10 sites will be fully operational as permanent supportive housing. And I think that is the end of our presentation. We're very happy to answer your questions and further discuss this really exciting program.
And I just would like to add one more thing in relation to Liz's discussion of the conversion process. Matt Diaz from our CEO Capital Programs team, who will be presenting on VIGNUS in just a moment, will be working with DPW to oversee that effort, which starts with the design process. So you might be seeing a little bit more of Matt if there are future home key presentations as we move into this kind of operations and then building renovation phase.
Any questions for Kelly and Liz at this time? We also have another presentation on the VIGNUS project, so we could save our conversation and discussion till the end of both if people prefer to move forward.
Well, I have a quick question.
Please, Ari.
Yeah, so my question is about, well, you mentioned that some buildings, the people already live there, so they get to stay. But number one is who gets selected to stay there? How long can they stay there? And how many people in a family or group can be there? So, you know, for example, mom with kids, is it only single persons? And the bigger question is, how long do they get to stay? Does this become public housing permanently, or is it a bridge housing situation?
Sure, I can answer that. So all of these properties were hotels previously. 2 of those were hotels that were used as a part of Project Room Key. So they were operating as basically shelter sites. Most of those rooms were occupied by individuals or couples. They were not family sites, they were for adults. So everybody that was in the Project Room Key site at those 2 locations was allowed to stay. The goal for those folks is to get them into permanent housing. So they're all working closely with the service providers to find permanent housing placements. And once those have been secured, they'll be exited to a permanent housing placement. So there's no sort of timeline by which they have to be out of the room key, now home key site. It's just once they've found a placement that's suitable for them, or obviously if they decide themselves to leave, then they're able to do that. The other sites, they were just, you know, hotel guests staying there. There was no one kind of long-term staying on site. They're not apartment buildings, they're hotels. And I will say, just to, in terms of families, one of the 10 sites, one of the sites in Compton will be a family site. It's a temporary housing site. We're not sure what the population will be once it converts to a permanent supportive housing site.
Hi, this is Monica. So I think it's important to say that or ask for that those that are going to be providing the services, for the permanent, for these sites, that they really are providing the services that people need. I've been working with this population for a long time, but I know that there's some units or some buildings that although there's permanent supportive housing, the support isn't really there. They're run differently. So I think that that's really important. And then the other thing is to understand that we need more family units because more and more people are becoming homeless. And the thing that I like about Project Room Key is that it allowed for couples to live together, where if people go into single-use occupancy units, then they cannot go in together. You have to find a different unit for the girlfriend or the boyfriend or whatever. But I think we need to focus a lot more on families as well. It's a good thing and I'm happy about it. I just want to make sure that people are providing the services that they say, because even when with the Project Room Key, because we were pulling people just off the street that were willing to go in, that of course qualified, but then they weren't, they needed the case management, and that was a bigger thing that people had to deal with, and to ensure that they're able to move forward to the housing process.
Yeah, definitely hear what you're saying. I think we'll see in these sites, as opposed to the Room Key sites, that many of them do have a much higher level of case management available. The Room Key sites were kind of constrained by some of the FEMA requirements that FEMA did not cover case management as a part of their reimbursement. For the home key sites, particularly the ones that are going to be administered by the Department of Health Services, there's definitely going to be a higher level of support, and clients are going to be matched to the sites based on their needs. So I think we'll see a pretty different scenario playing out at those sites. In terms of families, I do know that some of the City of LA home key sites are going to be serving families. So, and that is definitely a priority for our office, the Homeless Initiative Office, and we're very aware of the huge need for family sites. For these particular sites, they were not, for the most part, suitable for families, but that is a priority, and the county is looking closely at a lot of options for family housing. And in terms of this level of supportive services for the permanent supportive housing, I know that there are some older permanent supportive housing sites where the level of service may not be the same as the newer sites, but I know our Housing for Health team is going to be really involved in standing up these sites and ensuring that the appropriate level of intensive case management services is provided. So we're committed to making sure that these sites meet the needs of clients.
This is Ari once again. First of all, I wanted to thank you guys for all your hard work. As Kelly mentioned, usually takes a year to do one, but you guys got 10 or more, I guess, sounds like. So that's wonderful. Now, what about community engagement or buy-in? Do we do anything around that? And are any of these properties designated for individuals who, for example, came out of jail, or, that sort of thing, where the community would be, might be upset about it?
So Liz, do you want me to take the community buy-in question,
Sure,
or do you want to?
Yeah. I can add on
yeah,
to that.
So sure. So Ari, great question. We had very little time, as I said, to identify, let alone vet the properties, including, a full environmental analysis. So we relied on the board offices for local interface, which was done, I think, primarily with the cities. But we were moving very fast. So everything happened at every part of this process in a very compressed way.
Yeah, and I would just add to that. I mean, with Project Room Key, we definitely saw a lot of pushback from cities, but Fortunately, we didn't encounter that much pushback at all from the cities where these sites will be located. So they were received much more positively. And then some of the cities, in particular, like the city of Long Beach, has organized their own community engagement sessions, which we'll be participating in next week. They're obviously virtual sessions. And I know the board offices have reached out to some surrounding businesses and community members in the areas where these sites are located. So we're kind of taking it on a case-by-case basis and responding to inquiries and concerns as they come up. But again, they haven't been particularly acute in this case. As far as, particular populations, there's no site that's designated for like the reentry population. Obviously, they're not excluded, and our partners at Housing for Health work with a range of other departments and agencies that serve those populations. So, we're going to meet the needs of eligible clients, whatever their backgrounds may be. But I don't think there's a sort of concentration of any one population that might kind of arouse pushback from the community.
All right, thank you so much, Kelly and Liz. And with that, we will pivot to your colleague, Matt Diaz, who's going to be sharing with us on the Vinia Street project. Matthew, welcome.
Thank you so much. Can everybody hear me? Okay. So thank you so much for this opportunity to present to this group. This is a presentation on the Vigna Street housing project. If you can go to the next slide, please. So just a little bit of background and to orient everybody as to where this is at. Back on September 29th, Supervisor Solis introduced a motion to approve a housing project at the Vigna Street site. And as you can see from the map on the slide, Vigna Street is right in the middle of the map. And the adjacent areas around Vigna include the Union Station, which is to the south of that site. To the north is a Gold Line station. Oops. To the west is Chinatown as well as downtown LA, and the area is adjacent to some industrial areas, but there's also some new, I believe, apartment buildings to the northwest side of that as well. So it is in the downtown LA area, close to transportation. The property was purchased several years ago, and the intent of the purchase of the property was when we were going to develop or redevelop the Men's Central Jail location, and obviously that fell through about 1.5 years ago. So the property was vacant, and Supervisor Solis introduced the motion. The board approved it. The property will house about 232 individuals. Persons experiencing homelessness. You can go to the next slide, please. So that's a closer aerial view of the site. As you can see, Vigna Street is kind of to the south of that, Alhambra Avenue to the north. It is adjacent to the Metrolink site, tracks. Next slide, please. So here is a conceptual site diagram of what the Vigna Street housing project entails. And like I said before, it's about 232 units, all singles, 1 bedroom, 1 bath units. Site 1 is what we refer to kind of the northwest side of the property, those 2 long buildings. Site 2 is kind of the southeast area. You can see it's about four buildings to the southeast. Site 1 will provide 132 beds and 3-story structures. Site 2 is will provide 100 beds, and those are single-story structures. Up to the north side of the campus there, you'll see there's an area for parking as well as a kitchen admin building. And that is important because we are going to have programs and services provided on site. It's a full cook kitchen as well. So we'll have meals served out of the kitchen area. And there's a laundry area in that building. So folks who need to do laundry and can actually go and take care of that in that building. The site is 4 acres. So it's a fairly large site. And the hope is to have this similar to like a campus environment with several different amenities, as you can see, a dog park area, just to make it look and feel like like somewhere where you would like to live. Next slide, please. So the conceptual site rendering here, you can see, as noted, on the left side, you have the 2 buildings, the 2 3-story buildings. You have the single-story buildings in the middle. But it's, you know, the look and feel of a campus style feel. And at the north side of that, you have the admin kitchen building. Next slide, please. Another shot from kind of ground level, looking at the 3-story structures. Next slide. You have the admin kitchen building kind of at the north of that shot there. Next slide. So this is kind of outside of the dining area, the kitchen admin building. It's also functioning as a dining area, and here's some outdoor dining. And this is important because as we all know, going through the pandemic, we need some outdoor space to actually social distance and what have you. So this is going to be important moving forward. Next slide, please. So this is a typical layout of one of the units that are in the 3-story structures. As you can see here, it's they have room for a bed. There's a small kitchenette, and then there's a single restroom. Next slide. And this is just the square footages of the units and the renderings. This just shows 2 units kind of back to back. Each unit, I believe, on the site 1 side is about 160 square feet. So it's a nice size unit. Next slide. The site 2 unit, which is the single stories, this is the conceptual design for those. As you can see, it's similar to the site 1. You have a single units, bed, restroom, bed area, and these are probably around 150 square feet units. Next slide. And these just show the measurements as well of those. ADA units will be provided on site. So this is a mix of ADA and non-ADA units, which will accommodate individuals that have mobility impairments. Next slide, please. And just the project timetable. So we anticipate work on the housing units to be completed around December and January. Some of the punch list items obviously may trickle into February of 21, some minor things, landscaping and fencing to go into February. And then we anticipate that a program provider and services will start somewhere around March of 2021. So it's a very aggressive schedule. Like I said, Supervisor Solis introduced a motion on September 29th. So we're looking at, what is that, about 6-7 month time frame to complete. So it's a very quick project, a lot of things going on, expedited. but we wanted to make sure that we are providing housing for the county's most vulnerable populations. So, you know, we're trying to expedite and move this forward. And our partners at Public Works are doing a fabulous job of doing that. Have folks on the line also, Jerry Ramirez from our CEO Homeless Initiative that is helping with the services piece. So a lot of folks involved, and shout outs go to all of those folks. So thank you so much.
Thank you, Matthew. So as we've seen, like a lot of incredible activity happening in very short order around creating housing spaces and housing opportunities for the unhoused in our communities. Do we have some questions for Matthew?
This
Yes, this is Ari. Well, go ahead, Monica.
I just wanted to ensure, like, I know that they're going to get a provider for this, and I'm really, really excited because that's part of the Northeast area, or, you know, this area doesn't really have a lot of housing. It's not, I don't consider it downtown, but so I'm very excited about that. Is it going to go through the coordinated entry system as far as matching? Are all the units going to go in that? Through the LASA system is what I'm asking.
Hi.
Yeah, oh, go ahead, Jerry.
Hi, Matt. This is Jerry Ramirez from the Homeless Initiative. And Monica, thanks for the question. Yes, they would be going through the CES.
Okay, so this is Ari. First, I wanted to be clear on where exactly this is. Are you saying that it's on the same land where the men's central jail is, or it's next to it, or it's right over by the metro station?
Yeah, so if you can go back, thank you, Heather, for going back to the aerial view. So can everybody see my cursor kind of moving around?
No. Oh, yeah, yes.
So that is separate from the men's central jail. It is adjacent to the Metrolink tracks, and right on the east side of the Metrolink tracks is men's central jail. So it is somewhat in the general vicinity of that. If you go to the south, Union Station is actually a couple blocks away. And to the north of that, you'll have a Gold Line station as well. So it is kind of in an industrial area, but just to orient yourself to like the location of it, it is adjacent to areas such as Union Station, Men's Central Jail, Gold Line, as well as Chinatown.
So essentially it's going to be across the street from Twin Towers.
Yeah, it'll be about a block and a half away from that location.
Okay, and so is this designated as low-income housing, affordable housing? Is this rentals only, or is this ownership? I guess it's rentals only because it's a public
correct. I mean,
property.
right now it's going to be interim housing, so I don't believe there's an intent to charge individuals for actually living there at this point. And, you know, I think we're entering into a contract with a service provider that will provide the services and the housing on site for individuals that are experiencing homelessness that need to be housed. So, you know, it'll be county-owned property.
Well, I tell you, there's people that I drive by there every day. That's why I'm like, when is this? Where did this happen? But there's people who actually live on those sidewalks right there. So hopefully they can be helped. Right.
That's the intent.
And just so you know, Ari, the Willamette housing projects are just like right there. It's not right next to the Twin Towers. It's like a little down. And then I think it's the China, it's by Homeboy Industries.
Correct.
Yeah. So it's right by there.
Yes, I now remember they're almost done. I really do drive by there on Main Street very often.
We have other questions for our colleagues from the CEO's office on these incredible housing initiatives that are just imminent in our community.
So just an overall question. So you've added quite a number, as a team have added or are adding quite a number of units. But how much, do we have an overall goal, and where are we on that in terms of, are we halfway there? Are we almost there? Are we nowhere near?
Go ahead, Matt.
Yeah, I'm not sure of the total goal. I know that, at any one point throughout the county, there's, and Jerry, you can correct me if I'm wrong, but around 55 to 60,000 individuals who are homeless, including families and what have you. And so, I mean, I think it's important to understand the county's, push to house as many individuals as we can and families, and obviously it's a significant push that we're undertaking, and I think I've heard the number 5,600 individuals. 5,000, 6,000 individuals and families that we're trying to house in a short amount of time. Maybe I'm mistaken on that, but I think the initial push is to get around that many units, or maybe it's less. But I think
Yeah.
the intent is to make sure that what we are doing is we're making a concerted effort towards trying to house individuals throughout the county. And this obviously is the first big push that we're making towards that effort. Jerry?
Yeah, that's correct, Matt. Yeah, that is correct. These units are part of, agreement that the county and the city agreed upon recently.
They said, we're just going to send you all new equipment. They said, we can't figure it out. The guy got
I think we hear somebody. There's some background noise over here. I think Kelly. Yeah, hi. Oh, thank you. So I think that, so, the 6,000, that number that Matt, mentioned is really based on an agreement between the county and the city, where the city would be providing the capital for the units, for the interim housing units, and the county would be providing the services. So these 200 plus units would be are part of that 6,000 plus units. So this is just 200 units of many more units that are coming on board, and many more that are needed. And this is in conjunction with the thousands of permanent supportive housing units that are coming online within the next few years, that are being built by the city of Los Angeles, and also, other projects that are also being funded by the county.
Thank you, Matt and Jerry, for those updates. It's very exciting to see so much progress being made. And of course, we know the need seems to continuously outstretch the capacity, but it's wonderful to see the addition of all these new facilities. Any final closing comments from the group as we transition from the portion of our program today on housing the homeless to some other segments? We're going to be talking about transportation. We're going to get an update on our community benefits agreement with Third and Dangler. But let's close this out. Any final thoughts or reflections? All right, with that, I'm going to thank our colleagues very much who've joined us from the CEO's office. Once again, incredible efforts, everyone. We know this has been a fire drill of remarkable proportions, but what an exciting thing to see all of this funding and these resources flooding into our county. And it's just so incredibly powerful to see that such things can happen so quickly when the kind of the willpower, time, effort, and incredible passion is brought to bear on it. So thank you all so much for joining us today and for the work that brought you here.
Thank you.
Great. With that, we are moving into the portion of our program. We have some fantastic and exciting updates from our friends and colleagues at Supervisor Solis's office related to the Local and Targeted Worker Hire Project, the LAC USC Campus projects, and the Third and Dangler Housing Program. So I'm gonna check in and see if we're ready to get started with this. Guadalupe, I think you would be up first to talk with us a little bit about the board motions that are coming forward next week.
Yes, good morning, everyone. I just wanted to thank everyone and thank the speakers previous. There's a lot of great information that has been shared. And I also wanted to share some upcoming motions that are coming up next Tuesday. As you all have participated, in the local hire HICP committee, we've been, trying to really get at, increasing our numbers for local hire within the 2 mile and also reaching, trying to reach the aspirational goal of 50%, if not greater. One of the things that has been missing and that we've been needing is a job developer. And so I just wanted to share that on next Tuesday's agenda, there's going to be an award with a job developer that will be, it's up for approval. Hello?
We hear you.
Oh, there was a noise. I apologize.
Sorry, Guadalupe.
And so I just wanted to share that, it's good news that we have an award of a contractor that will be coming up next Tuesday for $350,000 for an annual contract. And, we're excited, to bring on board this contractor because the intent is really with the help of this contractor to establish a better coordination of our pipeline partners that will help us increase our numbers and again get people, the local folks, into the training apprenticeship programs and again be ready for the job opportunities that will come with the LACUSC campus projects, particularly the restorative care village phase 1, the child care center, and the demolition of the Women's and Children's Hospital. But again, the intent is not really only to establish a system for those programs, for those projects, but we want it to serve in the long term, that it create a pipeline, a strong pipeline that can connect with other job opportunities in the region, and serve us, again, to gain the local hires from our neighborhoods. And one of the things that we're looking at is also exploring, and with this contractor, the opportunity to have a lasting entity that can be in that position for the long term. And so we're thinking ahead, but it's very exciting. And I just want to thank Alicia, Public Works. They have helped us, get to this point of selecting a contractor. They had a committee as well. And so I just want to thank them for all their efforts and thank you all because you've been pushing, and reminding us that this is very important. And so I just wanted to make the pitch, if anyone is interested in joining the call in support of this, it'll be on next Tuesday's agenda. The second thing, I'll be real quick, is that we also have a motion with, we're co-authoring a motion with Supervisor Kuhl's office in regards to furthering anti-harassment protections with our eviction moratorium. And so that is being added to our eviction moratorium, the anti-harassment protections, and also other protections against eviction. And so, again, I welcome you all to join and in supporting next Tuesday, and really thank you.
Thank you, Guadalupe. Do we have any quick questions for Guadalupe about this job developers motion that will be presented at next Tuesday's Board of Supervisors meeting?
This is Ali. Hi, everybody. Hi, Guadalupe. Who would the job developer be reporting to? I may have missed that.
Pardon?
who will the job developer be reporting to?
The job developer would be reporting to obviously the Public Works, to the office, and HICP, and other also any other relevant entities as well.
Okay, thanks.
Mm-hmm.
Any other questions?
So Guadalupe, thank you so much for that incredible overview, and for the, if you can thank the supervisor for her leadership in bringing this forward. As you'll also hear a little bit later in the presentation of this section on the Third and Dangler housing project, developers and community really need that guidance and support that this development coordinator can really provide. And so some of us in the advisory committee of the Third and Dangler project discussed yesterday how important it is not just to look at each development project in and of itself, but to look at that regional impact, right, that we can make to ensure that we're developing a strong pipeline of local target hire for all projects that are coming on this campus as well as region-wide. So I'm very much excited about this motion. I'm glad that you're doing it, Guadalupe. I'm glad that it aligns with priorities of the Health Innovation Community Partnership. And I do encourage anyone who would like to present in support next week to let us know so that we can get you prepared for speaking at the Board of Supervisors next Tuesday. Thank you, everyone.
Thank you.
All right, with that, we will ask our colleagues from the LA County Department of Public Works and the LA County Department of Arts and Culture, Elisa and Iris, to give us an update on the campus project.
Good morning, Heather. Good morning, everyone. This is Alicia Ramos from Public Works. This is a great segue into us just doing a quick catch up on the projects we currently have going on at the LACUSC Med Center campus. So first in front of you is our Women's and Children's Hospital, which is going to be going into the structural demolition phase. Next Tuesday, December 8th, we have recommendations before the board to award the demolition contract. So we're very excited that this next stage is going to soon start to really make some changes there. And we acknowledge the history that Women's and Children's Hospital has played on the campus. And while it is the site that's had some very, I think, sentimental connection to community, as well as some controversial connection too, we are going to be moving on to the next stage. And so that will be coming up shortly. We will start to see a lot of change happen on this parcel. Next slide, Heather. These are just some images from what is currently going on with the Restorative Care Village Phase 1. And this location is right across from Women's and Children's Hospital location. So what you see here, photographs of steel erection. So if you're around the campus, this is what you're going to be seeing at the site. Before, you saw a lot of earthwork, a lot of in the ground type activities, but now we're going vertical. Next slide, Heather. This is also on the RCV Phase 1 site. We are also doing a lot of work next to the wall that supports State Street. Between Zonal and State, where the RCV project is being constructed right now, there's quite a grade change for anyone who's gone up State Street as it comes to the entry of the old hospital. It's quite a difference in elevation. So there is a retaining wall there. That part of our project, we are reinforcing that. So a lot of the work you'll see going on is focused on that wall, making sure that we've got it shored up properly and that it will be stable. Next slide, Heather, thank you. Quick check-in on our courtyard refurbishment and elevator addition. This is currently under bid. We will be getting those bids next Tuesday. So for many reasons, December 8th is becoming a very big date for us, I think, in general with these projects. So we're hopeful to get our bids back on the elevator, and we'll see how we fare with those and hopefully move forward with the construction of the elevators in the main courtyard of the new hospital. Next slide, Heather. Okay, and that brings me to Child Care Center. And we're going to spend a little bit of extra time on Child Care Center because as this project is developing and starting to also be the next thing on the campus that we see make physical change, we thought it was a good time to just go through some of the background. And for those of you that have maybe just joined HICP recently and attending the monthly meetings, or just refresher as to the progress we've made and where we're at in that process, we're going to spend a little bit of time. So Child Care Center is located on State Street. The new Child Care Center will be there. It's not currently. The Child Care Center that exists is in a trailer offsite. So we'll be bringing them onto the campus, which is a great advantage. So we see where the location is, and we've got a quick shot of what the anticipated building will look like. We've done make-ready work at the site. We're currently in plan check to get permitting completed. And we're also doing the civic arts process. Next slide, Heather. So some background on the Child Care Center. Child Care Center has been in the works for some time. It started back in 2018. It was kicked off with community meetings that included staff and parents that use the Child Care Center. There were 2 meetings that were hosted back in 2018, one on April 11, the other on June 27. The point of those meetings was to get input before the concept of the new Child Care Center was created, so that that concept could be informed with the concerns, the interests, the enthusiasm of the folks who more closely use that center. And so those discussions brought about these thoughts, these ideas, and that's what helped to develop what we called the scoping documents. The scoping documents essentially capture those wants, that criteria, the preliminary concept and designs for the Child Care Center. And what came out of that, next slide, Heather, was what you see in front of you. This was the concept for Child Care Center. And quite honestly, the concept was developed quite a bit more than we would typically. A lot of good input came from those meetings. A lot of hard work came from that in terms of what program pieces we'd need inside, what would make a more functional Child Care Center. But as you can see, it's a bit of a blank canvas. Next slide, Heather. Here's the overall of that concept, which for the most part, by and large, we've kept that massing. The concept here circled around that oak tree in the middle and kind of embraced these outdoor spaces. But again, the concept is meant to be a bit of a blank canvas. So we've taken that and we're now into a phase called design build. Next slide, Heather. So the design build phase is what we're in. So essentially what happens is we went out to bid to get proposals from design builders. And what design builder means is that we've done the initial concept with an architect, and now we went out there to find a design builder. And that means that this entity is not just a contractor, but they have an architect on board too. And so the county hands that concept over and says, here, these are the core elements of what we want. And the design builder then refines that, brings it to the next level of development. And the benefit of having a design builder is that the architect and the contractor work together. So the architect comes up with ideas, refinement, but they are able to reach out to the contractor and say, is this going to work? Is this the most cost-effective way? And so in a very synergy-oriented fashion, they collaborate together. And we think that that comes up with some very innovative ideas. So in this process, we've reached out, we're still developing, refining it. We obviously don't want to go back to the drafting board, right? We don't want to start over again because a lot of that good hard work that was done back in 2018, 2019, it's what we build on top of. And so what we've been looking at recently with this phase is just refinements. And LACUSC Med Center admin gave us some really good input on that. And what they had mentioned in particular is that this being a child care center really wants to see some color, some playfulness, you know, and develop that sort of neutral look on the outside to feel like it's engaging for children. And so that was great input that we worked with. We also got input that we needed some additional parking so that we could functionally make pickup and drop off of children easier on the parents. And then we continue to go through this. We just recently had some meetings in October 15th, we met with the operator of the child care center so we could go through the updates of the building with them, make sure anything that we've changed or suggested is functional and useful. And we had some really good input back from them. They were very encouraging, very supportive. They thought that the direction that the child care center is going is very much in line with what they need. So we're very happy to see that. And then of course, we continue with civic arts process, and we're also looking at exterior landscape. And again, color is another big aspect of that. Next slide, Heather. So here's the building rendering as we have it today. So what you're going to see is the backdrop white, but these pops of color have been introduced, and that was something that we did to make it more playful. You'll also see that the exterior areas also introduce that color so that the exterior, those areas that the kids are going to interact with, staff as well, also incorporates color. And then if you can focus, if you can see down towards the, I'd say on the right-hand side of the screen, there's a small courtyard there, and that's where we anticipate civic arts component. So again, contributing to that color. Next slide, Heather. So these are just other vantage points to see where those color aspects are coming in. Next slide, Heather. Back of the building again. And then next slide, Heather. So this is the landscape that we've been just recently looking at. This is all drought tolerant, appropriate for Southern California because we want to be cost effective in this, but we also want that landscape to be thought of as a part of the engagement of the building and the surroundings. So you'll see a lot of color in the species that are selected here, again, playing into that, you know, giving it a playfulness, giving it this sense of hopefully wonder and engagement for children. So with that, this focus on color, I'm going to segue into the civic arts component, which is a process going on. Iris Rain from Civic Arts will go ahead and tell us a little bit more about that process.
Thank you so much, Alicia, and thank you, everybody. This is sort of a particularly exciting meeting. Next slide, please. So just to reiterate a little bit of what Alicia said, if you see there the civic art wall opportunity, there will be a mosaic mural so that it's a permanent mural. What you're seeing here are also principles that were set forth by the community, and these are our guiding principles that are going to help create this exterior space where children can take a break before or after drop off, or staff can come and maybe have lunch, especially during these times where it's nice to get a little breather. So number one for us is welcoming, inclusive, and reflective of local community. Playful, again, accessible to children does not necessarily mean that these need to be drawings or images directed at children, but accessible to children. Repeated multiple times about inspiring trust and reassuring, and colors, but specifically warm colors were something that our parent community representatives talked about, and also your representative, Yolanda Duarte, who's here, hi Yolanda, and Jorge discussed. Next slide, please. So I wanted to just talk a little bit about where we are in this process. You've seen this chart before, if anyone has seen me speak about this, but we're right now on November 13th, we showed the selection panel. We showed 12 of 43 artists that submitted for the request for proposals. That was a general request for proposals. And the committee has selected 3 artists that are going to go on to do proposals for the art wall that will then be shown at a meeting on January 8th. And on January 8th, so we're going to convene on Zoom, and the artists will be selected for commission. I'm going to show afterwards just who these 3 artists are that were selected. And unfortunately, I want to keep this really short, so I'm just showing one image from each of the artists. And these are not images that, that are the images they're proposing. These are images of their past work. So I'm going to show these 3, and I'm also going to put my, my email into the chat in case anyone would like to comment. And I know, Yolanda, can I offer up your services if anybody would like to contact you and talk about this?
Absolutely.
Okay. So one of the artists that is going to do a proposal is Jose Antonio Aguirre. He is a very experienced artist and has done many murals. I do want to say that we specifically tried to open this opportunity to artists that were not necessarily mural artists or not necessarily mosaic artists. This is an opportunity that can be taken advantage of by different kinds of artists, and you'll see that there's sort of a range. Next slide, please. This is from an artist named Andrew Hem. Next slide, please. And this is an artist named Ricardo Mendoza. So these are the 3 artists that are going to produce work proposals for this opportunity. And they're working on the guiding principles. They're hearing from Francis Avila, who's the head of the Child Care Center. They've heard from parent representatives, and we're very open to hearing from you as well. So thank you so much.
Thank you, Iris. Thank you, Alicia. I think we're going to move next to our transportation presentations, and then we'll end our meeting with our update from the Third and Dangler Community Benefits Project, or the Third and Dangler Housing Project, which includes community benefits. So with that, we have the LA County Transit Oriented Design team here to share with us information about the TOD case study for East Los Angeles. So I'll invite Hank, Catherine, and Brian to unmute themselves and join us.
Good morning. Good morning, everyone. My name is Hank Shane, and I'm a planner here at LA County Public Works. I work in a section called Transportation Planning at LA County, and I'm the project manager for the LA County Transit Oriented District TOD Toolkit. Brian Marcetti of KOA and Catherine Padilla of KPA are also here with me today as the consultants on this project, and they'll be giving a presentation after my introduction and project background. Now, back in 2016, Measure M was passed in LA County to improve and expand the public transportation system. As part of Measure M, Metro is studying locations for additional rail lines and extensions of existing lines. Within LA County, there are potentially 10 new rail stations along 3 different lines. The East Side Transit Corridor Phase 2, which is the GO Line extension to the Lambert Station and the city of Whittier. The Purple Line extension to the VA Hospital, and the West Santa Ana branch, which is expected to go to Artesia. Within East LA, this includes a new station being proposed at Atlantic and Whittier. Around each of these stations, there is an area called a transit-oriented district that consists of mixed-use communities within walking distance of a transit stop, which is the half-mile radius of a station. In order to prepare for these new stations, LA County applied and was awarded a SB1 transportation planning grant from Caltrans to develop this transit-oriented district TOD toolkit. Now, what is the TOD toolkit? The TOD toolkit are guidelines that provide a framework to improve public infrastructure and transportation-related improvements to support land use decisions in areas around the station. The toolkit helps formulate, build, and support future TOD areas and provide the necessary guidance for future train stations, such as increasing mobility and accessibility, improving public health and safety, and reducing greenhouse gas and air pollutant emissions. Think of this project as a pre-planning phase where there is a reference document to help guide what characteristics and strategies should be considered for the future planning phase. Now, as we move forward in the process and the actual planning for each station, we'll still be doing more community outreach regarding the specifics of each station, such as with the first last mile planning, involving connectivity, accessibility, and mobility to each of these stations. These proposed stations are still going through environmental review and have not been approved by Metro. We are doing this project because we want to initiate the conversation early and be ready to begin the actual plans when Metro approves the environmental process. Metro will then be coming and actually begin their design and construction of the station, and we want to be ready to go. This project began in October 2018 and will be completed in February 2021. Throughout this project, we have met with various community groups, such as with HICP last year, held community events, sent out mailers to over 3,100 residents and owners in the project area 3 different times for different meetings, and have incorporated many comments into the TOD toolkit. We are here today because we want to share our findings and hear what other comments you would envision as an ideal connection. You don't have to think of everything right at this moment, as we'll be taking feedback for the next week. Our contact information will be available on the last slide. Like with the slides, Brian will be going through the slides. If you want to go back to the agenda, that'd be great. Thank you. I believe this is an important project and can lay the foundation to the actual plans if done correctly. Now, without further ado, I'm going to turn it over to Brian Marcetti to go over the TOD toolkit. Thank you.
Thanks, Hank, and good morning, everybody. Thanks for having us. We're going to be aware of our, could you stay on slide 2, and I'll just let you know when to move forward. We will be aware of our time limits. I'm just going to give you an overview for people who haven't been involved with the project or seen the project, and go through some of the changes that we've done to the document based on our outreach that we've done. So we'll talk about the project, we'll talk about the benefits, and community feedback we received. Our outreach lead, Catherine Padilla, will go over a call to action for the public and for agencies that are participating. And we'll talk about the upcoming community meeting and our art contest. Okay, next. So just to give a brief overview on the total TOD, transit-oriented district program that the county is enacting, there's 10 different major rail stations throughout the county that are the focus of this document. They're all rail stations that are existing or future rail stations that have county-owned incorporated areas within a half-mile walking radius of the stations. Particular focus of the TOD toolkit is a case study at the Atlantic and Whittier station, proposed station for the L line in East LA. And we're also doing some first last mile planning related to the toolkit for the planned Norwalk Boulevard station near Santa Fe Springs and the Lambert Road station on the west side of Whittier. But this gives an overview of the different rail lines that would be affected by these TOD guidelines and the rail station locations. Okay, we can go to the next slide. So the planned outcomes of this project, we want this to be a resource for businesses, community organizations, and residents as a vision tool for these station areas for residential, future residential development, commercial, mixed use, and jobs uses as well, employment locations. The guidelines include best practices for encouraging transit-oriented development around the stations to create communities around these stations, walkable areas, synergy between uses, the connectivity and access to transit. So this is an overall kind of an overarching document for planning. For each station area, there will be future specific plans that will get more into land use details, regulatory information, such. These are a set of guidelines. We've been doing a case study working with stakeholders. We had a community meeting at the Maravilla Center in East LA to discuss the Atlantic and Whittier area that we've been working on in some detail. We can go to the next slide. And next. So the overall components of a TOD plan, a mix of land uses working together, whether it's residential on top, commercial on the bottom, or adjacent. Street design, encouraging active transportation, life on the street, eyes on the street, active uses, engaging storefronts integrated with transit stops, walkable areas, green areas, etc. Buildings and urban design are part of this, although the document does focus more on the public realm and mobility, but there are guidelines as well for buildings and urban design, at least in terms of guidelines. Parking strategies, both for on-street parking and for any future potential off-street parking lots or structures that may be developed over time as part of developments or as county initiatives in the future. And then open space, whether it's part of developments or part of the sidewalk, parklets, etc. Those are addressed as well. Okay, next. So some of the benefits of TOD planning are increased transit ridership. The land use benefits from being around the transit station, the transit benefits from focus of uses around the station. So it's a partnership there in how this is planned. Reducing vehicle utilization, more walking trips can be made more comfortably within those neighborhoods, improving air quality, conserving land, being more efficient with development. Economic benefits include neighborhood preservation, balancing that with economic development, so that it's not just an open market kind of solution and vertical solutions. These are context sensitive solutions for these neighborhoods, keeping in character with what's developed there now. Increasing affordable housing, the guidelines are sensitive to that, providing some guidance on doing that in future developments. Reducing household spending on transportation, less auto ownership, more use of alternative modes. Let's see, and social benefits include housing and employment choices within closer distance of each other. Mobility choices from how you make your trips, health benefits, active sidewalks, as I mentioned, street lights. We can go to the next slide. Next. So some of the feedback we received, we had a few stakeholder meetings around the neighborhood in East LA working on our case study project to get detailed input into the guidelines on how they might affect the Atlantic and Whittier neighborhood. And we had a community meeting also to go into detail, pour over maps, get input on mobility, land use, those kind of things. So we worked directly over a couple months to get this input. But some of the feedback we received, I'll just kind of go over this quickly. A beautification of the sidewalk environment, how it's used and how it looks. Preserving cultural landmarks, preserving history to create identity. Creating mixed use development that fits the community. Improving businesses and also retaining local businesses. Parklets were desired, green space within the urban environment, gathering seating areas, preserving cultural spaces, local heroes. The history of the neighborhood is preserved and shown in the public realm. That was a idea that was presented by many of the stakeholders. Supporting local businesses is also some category of comments that we received, encouraging mixed use with the businesses. Providing enough parking for businesses so that customers can access those businesses. Next slide. So yeah, parking, whether it can go into vacant spaces now or underutilized parcels to support the businesses, incorporating greening into those parking lots, making them making them look good as they're developed. Something that came up a lot was a desire to, oh, you can, there you go, thanks. A desire to not reduce parking spaces, either in new development or with other projects within the street, such as the transit projects, bikeway projects, to not affect parking and to not remove travel lanes for those types of projects as well. We heard that comment a lot. That was part of the traffic issues, improving lighting for safety in the evening, including alleyways, which are used for circulation and walking quite a lot to get around the neighborhoods. Improving active transportation, potentially putting bicycle facilities on neighborhood routes, but improving circulation in general. Affordable housing, using abandoned buildings to reuse when there's that potential. Vacant lots, but and also keeping the affordable housing for the local neighborhood and not bringing in a regional draw for housing, but providing affordable housing for the local community directly. Next slide. So some of the changes we made to the document over time, and as you look at this online, we'll give you the link to the website. But in the top right corner of each page, there is a navigation ease. You can click on each section area to get to each section directly. It's a little bit interactive that way. The mobility topics as shown here, public realm mobility, these were moved to the front of the document to have more precedent in the document, although, as I said, it deals with mobility and land use together. And let's see, there's some other things that we changed. Some example photos we changed so that they're all within county areas to show county initiatives and county neighborhoods, to make it a little more localized. A lot of the language was simplified and clarified, and you can go to the next slide. On economic development and parking in some other areas, more guidelines were provided based on the input that received to make those more robust. And I believe that might be my last slide. Can we see the next slide? I will hand this over to Catherine to talk about the next topic.
So if you could go to the next slide, please, Heather. By the way, it's nice to see so many familiar faces. It's great. We've already talked about some of the outreach, and I want to acknowledge the groups that have contributed to this, including some of the members of HICP. So thank you for providing the input. Those issues and the feedback that you saw from Brian were directly from some of the outreach activities that, all of the activities that we engaged in. Just to back up a little bit, what the toolkit is, and those pictures that Brian was showing, is nothing more than a collection of very good ideas about how transit-oriented districts can be shaped around communities. The concern of issues that have been brought up from the community, underlying much of what we heard, I think, is not so much a fear of change, because we know that transit-oriented districts do bring some change, but more a fear of loss, a loss of the culture, a loss of the character. And so those guidelines are meant to address many of those things. And as Brian showed you in the toolkit, if you have concerns about or issues or ideas about economic development, you can go to that portion of the toolkit online or attend our community meeting, which is next up. And if you could go to the next slide, Heather, please. Really here to talk about some upcoming exciting things. So we notice in East LA, everything has to be intergenerational. And so we're holding a youth art contest that looks, that's called Young Visionaries, Future Planners. We can provide much more information about it. The deadline is December 7th. And we've been reaching out to all the high schools, all the middle schools, because the contest is open to all middle and high school students in East LA. And it's intended to ask students to envision their life with transit coming to their communities, what that could mean to them, how they see themselves using that. So I encourage you, if you know any young artists, to please help get the word out. Encourage them to submit their artwork by the 7th. And I put in the chat our information. And then on the next slide, Heather, please. I'm here really to encourage you, or we are here to encourage you to attend our community meeting on December 10th, where we'll go into much more detail about the issues that were brought up through our outreach and how we've addressed them in the toolkit. So I encourage you on December 10th, join our virtual community meeting. It's at 6 o'clock to 7:30. The toolkit will be available online through December 31st. And then after that, you can, when we ask you to submit your comments, and then after that, we intend to do one more feedback loop where we'll be meeting with more stakeholders to kind of review what we've heard and how can we refine the toolkit to better meet the community's, well, opinions. So I thank you for the opportunity, and I'd like to open it up for questions.
Thank you so much, Hank and Catherine. Any questions on the transit-oriented design project? As Catherine mentioned, there will be a larger and more robust opportunity to learn more about this project on December 10th, next Thursday. So please also consider putting questions and comments in the chat. We're running a little tight on time, and I know we have another transportation presentation, so I'm going to suggest we move forward with that presentation, and then we can ask all of our transit-related or transportation-related questions at the end of the second presentation. So with that, I'm going to invite our friends from SCORE. I believe we have Sylvia and her colleague, my apologies, your name escapes me, here to present on the, we have Sylvia and Elizabeth that are here to present from Metrolink. They're here to present on the SCORE Marengo siding project.
Good morning. Thank you for having us. We're here today to talk to you a little bit about the SCORE Marengo siding project. And just before we start much of the presentation, I want to make sure that everybody understands that the work that we're going to undertake is taking place in our right-of-way. So there is going to be no impact onto the general community. So as we move forward, I think that that's really an important point to make. So if you could go on to the next slide for me, please. Okay, this is just a very general overview of Metrolink. We are 538 miles. We go north to south, east to west. We go up as far as Palmdale, Lancaster, as far south in near Oceanside and to Ventura, and all the way out to San Bernardino. So we're a very large system. The majority of the trips during the week, not surprisingly, well, before COVID, were work-related, and the majority of riders cross county lines. So they go in from one county to the other. And as you can see, the average trip length of 36 miles. But the good point, the main thing to remember about that is that we eliminate 9.3 million car trips annually. So instead of people jumping in their cars and driving somewhere, they're actually using Metrolink, and we're helping reduce emissions in our air. Next slide. And basically that's what we talked about. I know we're short on time, but we removed quite a number of cars from the freeway. So next slide. You can see from there, and I'm not going to go into a lot of detail, but it's Metrolink system provides a number of benefits, including jobs, opportunities for communities to, we contribute to the economy. And especially now with COVID, we have a lot of the essential workers we found use our system. So we've continued to operate because a lot of the doctors, nurses, et cetera, use our system to get to and from work. So I think we've become an essential service for the world as it is today. Next slide, please. This is just it shows what our SCORE funded projects are. You can see that there are a number of projects, including the Marengo siding extension, which is what we're here to talk to you about today. Next slide. The goal of the SCORE project is to create improvements on the system that will help us with the Olympics that are coming in 28 and the Paralympic Games that are after around that same time. And it's an opportunity make safety improvements at stations and at grade crossings. It allows for where you're standing at a train, know that in half an hour, another train will come by. The other thing with this project, it is going to provide an opportunity for a number of cities to create quiet zones. And as you've heard from our colleagues at Metro and a lot of the other transportation presentations, is the idea to move people into affordable housing or for transit-oriented development. So we're looking to make this a more unified system. And also we connect with bus services, et cetera. So we're trying to create a system that if you don't have a car, you can still move around. Next slide. Next slide, please. Okay, this is our SCORE timeline. Again, our goal is to be, oops, one back, please. Okay. All right, there we go. Thank you. That's our SCORE timeline. So it's just basically, we started in 2017. We want to be done by 2028. We are in the environmental process currently, and currently the environmental clearance that we're looking for the Marengo siting project is for a statutory exemption. So that's one of the reasons why we're here to talk to the community, so that they're aware of what we're doing and they're not surprised when we start working. And it's also an environmental clearance that's necessary for any type of large construction project. Next slide. Next slide. Okay, so all righty. So these are where we're going to, I'm sorry?
You want me to pick up from here?
Yes, please.
Okay. If you can go back one slide, actually.
I think there's a delay in Sylvia, and you're seeing the updates of the slides. I think that's part of the challenge.
Okay.
Oh, no problem.
Okay, so hi, I'm Elizabeth from Metrolink. So the Marengo Siting Extension Project specifically would allow for more safe and reliable service. So combined with other projects, we showed the project map earlier. So we have a number of projects on the San Bernardino line, and combines together, it does provide safety improvements and also enables more frequent services. So as Sylvia said, up to 30-minute services in either direction. And then also improved on-time performance and reliability for the San Bernardino line, and less idling time as well, which will reduce emissions. And the thought process there is, imagine a one or a single lane highway where you would have choke points between vehicles and they would not be able to pass one another or would have to hold at a further point. So by having now this siting track extended further, we are able to run trains passing one another without having to idle. Next slide. So this is an illustration of the Marengo siting project. What you see in the double solid line is I-10. And so our tracks run fairly parallel with the freeway. And in the gray line is the Metrolink railroad tracks. And we have two tracks that currently exist. And what we're doing is that we are extending the siting track, which is what you see in green. We're extending it by approximately 3,325 feet. So the total length will then be over 10,000 feet. And then what's denoted in the blue points are just where we have signaling equipment and towers that the railroad runs on. Okay, next slide. So again, this just reiterates what the siting length is. In total, we'll be increasing it by 3,000 feet plus, and then the total length will be 10,000. It'll terminate just around where we have Fowler Street. The existing main track will exist there and stay in place while we construct the siting track extension. The work is primarily within the railroad right-of-way, and what we will do at the Marengo and Soto Street overpass is safety improvements, where we will build what we call pier protections, which is a wall in between the track and the columns so that we protect the existing structure. Next slide. This is our timeline for the Marengo project. We're currently in the design phase and environmental phase. So the design, we are currently moving into our 65% design and then final design. So that's, we're looking to wrap that up here at the end of 2021. And the environmental phase also have that wrapped up early on in 2021. And then the construction will begin in the latter part of 2022 and take us out approximately a year to complete. With that said, just ensuring that we keep the community and the public involved with whatever work we perform and keeping everyone abreast of our developments. Next slide. Next steps for us is making sure we work with the city throughout the process. So entering any agreements, obtaining any permits with the city. I believe, we might have to access a few points to get to the site. So maybe temporary easements or whatnot, but working with the city also to review designs where we interface, coordinating work windows or traffic control plans, and then partnering for outreach while supporting the overall Metrolink vision. Next slide. With that, I'll hand it over to Sylvia.
Okay, thank you, Liz. As Liz pointed out, these are some of the goals of the program. This is my contact information. We will be having a community meeting December 9th, which we invite all of you to participate. If you live in the immediate area, we did mail to over 1,000 homes, but if you did not get the invite and are interested in participating, you can reach me at either of those numbers and we can put you on our list. And we hope to hear from you if you have questions or as we move forward through the project. We're not going to start construction, Liz, I think until 2023 once we get the environmental clearance. So we are very early in the process, but we wanted to make sure that we came to the community to let them know what was being planned so that if they had questions, issues, or concerns, they could share them with us early in the process.
Thank you so much, Sylvia and Liz. I did want to mention there is a question from Ruby in the chat about how this might impact communities like Ramona Garden that are already heavily impacted by rail traffic. I'm going to ask anyone else who has questions for any of our transportation presenters to please avail yourself of the chat room right now, as we have kind of run out of time for the presentations of our meetings, and we have one more presentation to go. I'm going to ask that all questions be managed through chat at this time, or follow up with our presenters one-on-one if you'd like additional information. With that, I'm going to move on with our next presentation, which is on the Third and Dangler Community Benefits Agreement. And with that, I will invite our friends and colleagues, Zoe and Cynthia, I believe, to join us and present on the Community Benefits Agreement with Third and Dangler.
Good morning, everybody. Thank you again for having us this morning. Can everybody hear me okay?
Yep, we got you, Zoe.
Okay, good. Yes, so we are moving pretty quickly. I don't know, should we give, I know we're short of time, so I'm just gonna give a quick overview of the project and a quick update on the CBA and the status of the project itself. So as you know, Third and Dangler is in unincorporated East LA at the corner of Third and Dangler. Third and Dangler probably is not going to be the final name, but that's what we're calling it as of now. And I believe the last time we spoke, we had communicated that we had completed the development agreement with the county and therefore signed the community benefits agreement. We have also received funding from the state for the Affordable Housing and Sustainable Communities Program, which is going to allow us to proceed with not only with the housing, but with a number of transit-oriented and pedestrian improvements around the community. Since then, we have, I don't know if you want to go on to the next slide, see if we have a better slide here. This is the location in East LA. It's right across from the, I guess it's the gold line. I can't remember what it's called now, but it's the gold line between the Maravilla station and the Civic Center station. Next slide. Let's just go through the slides really quick. Here's the development. Oh yes, so at that time, I think we were still, you know, trying to figure out what the funding was going to be. But since then, we did receive the Affordable Housing and Sustainable Communities. So which means that we're going to move forward with Plan A, which means we're going to have 78 units, 20 studios, 49 one bedrooms, and 9 2 bedrooms. There is going to be under this scenario, we're going to have a parcel next door that is going to be a pocket park. It's a very small kind of sliver of land that we were able to acquire from the neighbor, privately owned parcel that we were unable to incorporate in the overall design because of timing, but it will be a community benefit in terms of a pocket park. Next slide, please. Before we go into the committee updates, I did wanted to kind of just let everybody know that it looks like we are all funded. Next week on Wednesday, we are up to receive tax-exempt bonds, which is going to allow us to start construction actually in June. So that's the really good news that we were very competitive in this last round of bonds. And initially, I had communicated with Guadalupe at the supervisor's office that it looked like we were not going to be funded, but the state made available some additional funds because they ran out of bonds basically. And we got lucky. Our project is competitive, so we were able to squeeze in. And that means that now we're completely funded and we are going to be able to start construction in June, like I mentioned. So that means that the committee work that we're doing is very important because we need to absolutely press on the gas pedal and get all these committees working. Fortunately, we have been working with the park committee and the art committee. Next slide, see what's next. Yes, these are the committees, the pocket park, the public art, the local and target hiring, and the local notification and outreach. The pocket park and the public art have already met a few times, and actually we're making really good progress with the pocket park, working with from lot to spot. They are heading this this committee with the community. And Lou Calanche from Legacy LA is the chair of that committee, and the committee has met a few times, and they're right now engaging in public outreach along with Legacy LA. And I'm not sure if Cynthia's on the line. We have a committee meeting in 10 minutes. So, are you on the line, Cynthia? Maybe not. Okay, so but we are.
Zoe, I think Cynthia is not on the line, but Yolanda will cover the committees.
Oh, that's right. Yes, I forget about that.
Thank you.
Yeah, so we'll let Yolanda cover the committees. That's right. So, but I did wanted to just emphasize that we're very excited that we were able to obtain all the funding necessary to start, because for a minute there it was looking like it was going to be a couple of months delay. But having said that, I'm going to hand it over to Yolanda, and she will take us through the work we've been doing with the committees.
Okay, should we go to the next slide, I guess? You've pretty much covered.
I'm sorry, I forgot about that.
That's not to worry, Zoe, not to worry. We're just all crunched up here with time. The slide prior, please. Thank you. So there are 3 committees, as Zoe mentioned. There is the advisory committee. We've met 3 times already. We had our 3rd meeting yesterday so that we could plan on what we were going to say today. But mostly our oversight responsibilities are to just watch over the program and the project benefits to make sure that they're corresponding with resident needs. and engage more local residents in some of the committees. That would involve, since most of the committees have met at least a couple of times already, so catching people up to speed. But the more that we have local input, the better. We're making sure that that we're hitting the milestones that we've targeted. And so far, so good. And I guess yesterday, Zoe mentioned the acquisition of additional funding, and that put their project on Project Warp Speed, I guess. So they're gonna really, really work. I think she said she was gonna press the pedal to the metal, if I can remember that. All right, next slide. So the Pocket Park has also met 3 times. They meet on Fridays, so right after this. The selection of the layout is here, but the design hasn't been finalized. And so they're going through that process. Again, that whole effort involves a lot of community input and working within the system, you know, the actual system that the process, I might say. And I think going through entitlements is probably the most engaging part of this process, right? Because of the details that are involved. Next slide. And the local art committee. So that's led by Betty and Avila. They meet on Fridays at 12:30 to 1:30. They actually sent out a request for qualifications for artists already. And here's where we've had some impact by having community members on. So they were able to align the community needs and revise the structure so that it was more inclusive, and we were able to reach out to additional artists and engaging. And so I think this is where the residents really impacted National Core and their implementation partner for better outcomes. So we're looking for artists, and if you know an artist and you'd like to have them inquire, then they can, maybe we can put that email in the chat if somebody would do that for me. Submit at nowartpublic.com so that we can make sure that it's there for everyone. And pretty much that covers the work. I think we want to make sure that that we're accountable. Guadalupe mentioned the local target hire and the acquisition of a job developer. I think that's going to be really important for us as a community, so that not only that we're transparent, but that so it's a cohesive effort for capital projects along the line. I hope I touched on everything. I know we're so short on time, but if you have questions, shoot us a message and we'll get back to you and make sure that we have, oh yeah, so here are the sites for public art, and so you can see them by the arrows. Using my cursor won't help, so whoever's sharing, said Heather, there you go, right there. Thank you, on those public spaces. So I think that would be the end of my presentation, or whatever I could add to this. But we have enjoyed working with these committees, and we see now that escrow is going to close, and I think construction are they wanting to start about the second week of this? When did you expect?
June.
So
So I
June.
think, yeah, June, and a little bit of an update on that on the local hire is that we are going to start working very closely with the local hire committee to identify all the resources and organizations and programs that can help us be successful in this in the local hire portion of the program. I think this is one of the local hire component. You know, it's always very challenging, but under the current circumstances, you know, of the COVID situation, it's a little more challenging. So we really are hoping to start that in earnest right away, and so we'll be asking a lot of help from you folks. So,
And this is really fast tracked at this point. So thank you very much. Totally appreciate it.
Thank you so much, both Zoe and Yolanda, for sharing with us. Again, exciting progress being made on bringing affordable housing, supportive housing to the community, and bringing it under the context of a community benefits agreement that allows for an integration of this space into the larger community, both through art and other design elements. With that, of course, we are not only at time, but a little bit past time. Thank you everyone for your presence, your participation today. There are a couple questions in the chat related to the Metrolink site. So if either Sylvia or Elizabeth has an opportunity to respond to those, we will capture the chat and we will send those meeting notes out to everyone after this meeting. I just want to say thank you for joining us throughout the year of 2020, as we've had to pivot to virtual meetings starting in March of this year. And of course, we don't see exactly the clear end in sight for where we're at. We've been delighted to be able to use the Zoom platform to continue to engage with the community and to support different conversations with all of you, and to make sure that the best information from county projects and developer projects in the area are brought to this table for conversation and discussion. Thank you again. We will be resending out meeting invites to encourage you to join us next year. We will continue forward with the first Friday of every month, barring a holiday. So that means that our next meeting will be January 8th at 8:30 meeting room opens, 8:45 meeting start time. So we hope to see you there. And thank you one and all for joining us today.
Thank you, Heather. Thank you. Have a